Good morning. My name is Muhammad Hamza, and I am working as a resident trainee medicine here in Pakistan. I'm also working as a research scholar at University of Kentucky. Today, we will be talking about efficacy and safety of talquetamab treatment in refractory and relapsing multiple myeloma. So let's start. In 2023, the FDA granted approval for talquetamab in patients who were suffering from relapsing and refractory multiple myeloma, and they had received four prior lines of therapy, including a proteasome inhibitor, immunomodulatory agents, and anti-CD38 monoclonal antibody. What is multiple myeloma? Multiple myeloma is a tumor of plasma cells, and it is characterized by monoclonal plasma cells. These tumorous cells are present not only in the bone marrow, they are also present in the peripheral body and leads to various signs, symptoms, and complications in the body, which include hypercalcemia, renal failure, anemia, bone pain, and lytic infections and lytic bone lesions. Currently, there is no existing therapy which can lead to 100% cure. Various therapies are used, which leads to decrease in symptoms and also decrease in progression of disease. But there are some individuals in which even that treatment is not effective and they may lead to relapse. They are known as relapsed or refractory multiple myeloma. Various combination of treatments are used for multiple myeloma. It includes steroids, alkylating agents, proteasome inhibitors, immunomodulators, selective inhibitors of nuclear exports, monoclonal antibodies, and B-cell maturation antigen targeted therapies, which include the talquetamab and other monoclonal antibodies. G protein coupled receptor membrane D, which is present normally in nails and hair. Genetic expression has showed that bone marrow, that multiple myeloma has also these receptors. When they are targeted, it leads to decrease in the myeloma cells and hence decrease in progression of disease. How talquetamab works? Talquetamab is immunoglobulin, and it is a bispecific antibody that is it attaches to both T cells and also to GPRC the receptor, and it causes simultaneously activation of T cells and also destruction of myeloma cells through production of granzymes and porphyrin from T cells and hence killing of the cells. This is the diagrammatic uh, picture of talquetamab mechanism of action, and as you can see that there are two cells. One contains the GPRC5D receptor, and the other contains the CD3 protein, which is present on T cells. So you can see that there is production of porphyrin and granzymes from T cells, and it leads to destruction of myeloma cell. Efficacy of talquetamab. So certain preclinical investigations were done and subcutaneous doses were given to the patients who were suffering from relapsing and refractory multiple myeloma, and it was seen that 32% of the patient achieved the complete response, and the 73% of the patient had an overall great response rate. So this is a research summary of the talquetamab clinical trial, after which it was approved by FDA by Dr. Chari et al. And as you can see here, that there are two endpoints. One is primary endpoint and one is secondary endpoint. The primary endpoint is the adverse events, and the secondary endpoint is the efficacy. So there were 232 patients, and it was open label multi-center two-part study, and patients were given talquetamab one in weekly and one two weekly. So those patients who were given weekly 405 microgram per kg, 70%, 70 patients showed complete response, and 80 microgram patients who were given every 2 weeks, 64%, 64 patients showed a great response, which is quite a huge number. That is 134 patients out of 232 patients had overall great response rate. There are specific drug adverse events which are related to talquetamab, which include dysphagia, that is a loss of taste, skin-related events, the most commonly inhaled disorder, the cytokine release syndrome, which is characterized by aggressive immune system response against infection, and also various infection, hematological adverse event, and neurotoxicity. This is a diagrammatic table which shows the adverse event in descending order. That is grade 3 and grade 4 adverse event which need hospitalization. The second is cytokine release syndrome. Third is skin-related event, dysgeusia, neutropenia, nail-related events, lymphopenia, anemia, thrombocytopenia, and neurotoxicity. How to manage toxicity? In order to manage toxicity, talquetamab should a patient who was given talquetamab should have direct access to critical care facilities. They should have capacity for neurological evaluation treatment, and they should be prophylactically given acyclovir, valacyclovir, or Bactrim in order to treat viral infection prophylactically. And they should also be given vaccines for shingles, COVID-19, influenza, and all those vaccines which are indicated for patients. Oral cavity infections should be treated, and the mucositis dry mouth should be treated with artificial saliva, biotin sprays, anesthetic mouth washes, and all those nails and skin adverse event can be treated with lactate cream, Vaseline, and various topical steroids. Talquetamab-based combinations. New studies are ongoing, which include a TRIM study, which was done, in which combination of drugs, that is monoclonal antibodies, were used in patients who were suffering from relapsing and refractory multiple myeloma. And it was seen that the patient had a great response rate. The reason is that daratumumab include the removal of T cell regulatory proteins, which leads to increased stimulation of T cells and hence enhancement of cytolytic activity of T cells. The phase 3 study showed that out of 93 multiple myeloma patients with extensive histories, it was shown that 86.6% had a partial response rate and 40.2% had a better response rate. And the overall progression-free survival was 20.9 months, which is quite a huge number because previously it was 11 or 12 months for other therapies. So this is one of the promising results of combination, though it was done in very small sample, so we cannot conclude the results on the basis of this. So taking points from today's presentation is that talquetamab is quite a promising therapy for treatment of relapsing and refractory multiple myeloma. Various combinations are now used, that is daratumumab and teclistamab, in order to treat refractory and relapsing multiple myeloma, and they has synergistic effect. And new clinical trials can be done in order to see the overall response rate so that we can use it on multiple myeloma patients. These are the references of the various researches and all those data which was used in this presentation. So I thank you all for patience, and we can meet some other time. Thank you and have a nice day.